Hello friends, welcome to Ezinurse where nursing education made easy. So Ezinurse is conducting the exam series that is Lecture 3.0. So today, second year GNM Medical Surgical Nursing 1 and 2 we are going to discuss detailing. So today's topic is Medical Surgical 1 and 2. Both the subject we will discuss the important questions and answers. So let's start students, and let's the GNM second year GNM students be attentive. This will definitely help you to get the pass marks. So let's discuss. So first we will see about the Medical Surgical Nursing 1. The important questions from the first part, Medical Surgical Nursing 1. So first give the meaning of following. So let's discuss some of the words meanings first. That is also the first question you will get in the examination. The first paper in that first part it will be you need to answer 4 meanings of the words. So first one, anaphylaxis. So let's discuss what is anaphylaxis. So what is anaphylaxis? It's a severe sudden allergic reaction that can be life-threatening, that is causing difficulty in breathing, swelling and drop in the blood pressure. So that is the definition of anaphylaxis. It's a severe allergic reaction. That can be life-threatening, causing difficulty in breathing, swelling and the drop in blood pressure. So that's the definition of anaphylaxis. So next we will discuss about fistula. So what is the definition of fistula here? An abnormal connection or passage between two organs. So it's an abnormal connection between two organs or an abnormal passage between two organs or between an organ or the skin. So that condition is known as fistula. It's an abnormal connection or passage between two organs or between an organ. So that is fistula. So that's the definition of fistula. So now let's discuss about the third word, that is fumigation. So what is fumigation? It is the process of disinfecting an area by using smoke, gas or vapor to kill germs, insect or pest. So we are using disinfectants to kill the microorganisms. So that is the process of disinfecting an area by smoke, gas or vapors to kill germs, insect or pest. So that is the definition of fumigation. So the next word we are going to discuss is nursing process. So what is nursing process? It's a systematic method used by nurses to plan and provide care. So it's a systematic method we nurses using to give the care to the patient. So it includes assessment, diagnosis, planning, implementation and evaluation. So that is the 5 steps of nursing process. So there are mainly 5 steps. So what are the 5 steps here? It is systematic method. So what are the 5 steps here? Assessment, diagnosis, planning, implementation and evaluation. So the next word we are going to discuss today is glossitis. So what is glossitis? It's the inflammation of tongue often causing redness, swelling and pain. So the tongue, if our tongue has inflammation, then it is known as glossitis. It is a inflammation of tongue that is causing redness, swelling and pain. So that is the definition of glossitis. Next word is injury. So what is injury? Damages to the body caused by accident, trauma or physical harm. So if any accidents or any damage or any faults, there will be injury. So injury is the damage to body that is caused by accidents, trauma or physical harm. So the next word is edema. So what is edema? It's a swelling caused by excess fluid accumulation in the body tissue. So if excess fluid accumulation in anywhere in the body tissues, what will happen? There will be swelling or edema will be present. So that is what called edema. So next word is atelectasis. So what is atelectasis? Partial or complete collapse of lung. It is either the partial or either the complete collapse of lung or part of lung leading to reduced or absent gas exchange between oxygen and carbon dioxide. So that is completely or partially the complete or partial collapse of lung or a part of lung is known as atelectasis. So that condition is known as atelectasis. So next word we are going to discuss is inflammation. So what is inflammation? The body's protective response to injury or infection causing redness, swelling, heat, pain and sometimes loss of function. So it is body's response, our own body's response to a particular infection or an injury. So if you had an injury, your hands will get swelling or inflammation. So that is the protective response of our own body to the injury that will cause redness, swelling, heat will be there. That area will be having heat, pain and loss of functions will be there. So that is the definition of inflammation. Now the next word we will discuss is sterilization. So what is sterilization? The process of completely destroying all microorganisms including bacteria and spores to make an object or surface completely germ-free. So it is a process where we are using the techniques to destroy the microorganisms and as well as bacteria and spores. So that process is known as sterilization. So that's the definition of sterilization. The third word that we are going to discuss is epistasis. So what is epistasis? Medical term for nosebleed, the bleeding from nose. So that word is known as, or that is what defined as epistasis. It is bleeding from the nose. So next word is goiter. So what is goiter here? It is an abnormal enlargement of thyroid gland. So there will be abnormal enlargement we can see in the neck area. So it is abnormal enlargement of thyroid gland, often visible in swelling in the neck. So that is abnormal enlargement of thyroid gland. That is defined as goiter. So that disease condition is defined as goiter. So now let's move on to the next word, that is gingivitis. So what is gingivitis? It's the inflammation of gums. So in our mouth, gums will be present. So the inflammation of gums is known as gingivitis, causing redness, swelling, bleeding, usually due to poor oral hygiene. So it is nothing but the inflammation of gums. So the next word we will discuss is hemorrhoids. What is hemorrhoids? Swollen veins in the rectum or anus that can cause pain, itching or bleeding. It is swollen veins in the rectum or anus will be present. That is termed as hemorrhoids. Next is ataxia. So what is mean by ataxia? It is a loss of coordination of muscle movements leading to unsteady walking or difficulty in performing tasks. Nothing but loss of coordination of muscle movements. So that disease condition is known as ataxia. Next word is alopecia. It is what means hair loss or loss of hair. So what is loss of hair? What is alopecia? Loss of hair from the scalp or body which can be temporary or permanent. So like as an example, cancer treatment, chemotherapy. After that, the side effects will be alopecia, means the side effects will be hair loss. So it is nothing but hair loss. So next is chemotherapy. The treatment of cancer using drugs that kill or stop the growth of cancer cells. So we are using here, some examples are cisplatin and vinblastine. So these are the examples of chemotherapy. So it's a treatment of using drugs. That is what called chemotherapy. Treatment of cancer using drugs that to kill or to stop the growth of a cancer cell. So that is chemotherapy. So what is hemophilia? So hemophilia is a blood disorder. It's a genetic disorder where blood does not clot properly. It is affecting the blood where the clot formation of blood will not be properly, leading to excessive bleeding, even a minor injury. If it is a small cut also, that person who is suffering with hemophilia, they'll have a bleeding, excessive bleeding. So that where there is the clotting factors will be lacking. So that is hemophilia. So the next word is metastasis. So what is metastasis? The spread of cancer cells from original site to other parts of the body. So from the site, if that person had a cancer in lungs, from lungs it will be shifting into other parts like lymph nodes. It is affected. It is affecting the liver. Then it is what called metastasis. One particular part, it is spreading to the other parts. So that is what known as metastasis. So the next we will discuss about some fill in the blanks questions. So what is normal level of potassium in the blood? It is 3.5 to 5.0 milli equivalent per liter. So what is the normal potassium level of an adult in blood? It is 3.5 to 5.0. Presence of protein in the urine is called proteinuria. So that person who is having diabetes mellitus, who is having the uncontrolled glucose level or uncontrolled blood sugar level, they'll have the presence of protein in the urine. That is known as proteinuria. So that is the word. Next is difficulty in swallowing is called dysphagia. If that person is having difficulty in swallowing, it is known as dysphagia. Next is abnormal accumulation of fluid in peritoneal cavity is called ascites. So in the peritoneal cavity, abnormal accumulation of any kind of fluids, that the condition is known as ascites. So next is dash is the surgical procedure that involves removing a part or all an organ, that is excision or resection. So excision or resection is a part where we are removing one part or the parts from the or organs from the body. Dash is marked as an increase in urine secretion. Diuresis. Diuresis will be helping in increased urine secretion. Immunotherapy is an allergen that is dash therapy, desensitization therapy. Immunotherapy is an allergen desensitization therapy. Decreased level of potassium is called hypokalemia. So increased level of potassium will be called hyperkalemia. So what is kalemia? Like potassium level. Hyper is increased level, hypo is decreased level of potassium. So presence of protein in urine is called proteinuria. Increase in serum level of sodium. So in your body, if the sodium level is increased, what will happen? It is hypernatremia. So the sodium level in your body is decreasing, it is hyponatremia. Hyponatremia means increased sodium and decreased sodium. Next is the action of laxasis. What is laxus? It is a diuretic, or it increases the urine output. The presence of stones in the gallbladder is known as cholelithiasis. So the person who is suffering with gallbladder stones, or that is known as cholelithiasis. So next word is an enlargement of thyroid gland. We have already seen the meaning. It is known as goiter, where the neck region has a swelling. So the enlargement of thyroid gland is known as goiter. Collapse of alveoli is called atelectasis. So here the parts of lungs, or the lungs, will be partially or completely collapsed. That is the process, that is the disease condition is known as atelectasis. Example of absorbable suture. So in the operation theatre after the surgery, we will use the absorbable suture. So examples are vicryl or catgut. It will be absorbed in our body itself. So that is absorbable suture. Normal level of cholesterol in the body, it should be below 200 mg per dl. So that is the normal level of cholesterol in the body. Inflammation of eyelid is called blepharitis. So the inflammation of eyelids, it is known as blepharitis. So blepharitis is the inflammation of eyelids. Acute peristonsillar abscess is also known as quinsy. So what is quinsy? Peristonsillar abscess. Acute peristonsillar abscess is also known as quinsy. Next word is inflammation of breast is called mastitis. So mastitis is a word for inflammation of breast. Dash is caused by the bite of dog. So what will happen if the bite of dog? That is rabies. Rabies will caused by the bite of dog. The tuberculosis is caused by Mycobacterium tuberculosis. An abnormal decrease in the number of platelets is called thrombocytopenia. So the abnormal decrease in the number of platelets, that disease condition is known as thrombocytopenia. Normal value of calcium in the blood, that is 8.5 to 10.5 mg per dl. So collection of pus in the pleural cavity is called empyema. So empyema is a condition where there is collection of pus will be in the pleural cavity. So that disease condition is known as empyema. So that are some fill in the blanks questions that may come for your exam. So it has came multiple times in the previous year questions paper. So you can able to see if you are taking a previous year question paper, these questions are already repeated a so long time. So you also expect these questions to be in your exam. So further discussion or further anything new you need about these disease condition, you can download Ezinurse from the Play Store and App Store. So now let's discuss about state whether the following statement is true or false. Some true or false questions. Let's see. So a butterfly ration seen in systemic lupus erythematosus. If the patient or the person is suffering with systemic lupus erythematosus, they will see a butterfly rash in their body. It is a true statement. So that is the symptom. Thyroid stimulating hormone stimulates thyroid gland to produce thyroxine. Yes, it is true. So thyroid stimulating hormone will stimulate the thyroid gland to produce the thyroxine. That is the true statement. Next question. Inflammation of stomach is called stomitis. It is not. Inflammation of stomach is known as, that is inside that is gastritis. So it is inflammation of stomach is also called, it's stomitis. It's a false statement. Fourth corneal nerve is optic nerve. No, it is not, because the optic nerve is not the fourth corneal nerve. Dehydration is a condition resulting from excessively high levels of fluid in the body. It is a wrong statement. Dehydration is because the body have a decreased level of fluid in the body. So if excessive, it is not. It is overhydration. If it is this dehydration, it's condition resulting from the decrease in the levels of fluid level in the body. So it's a false statement. Splint is used to immobilize a limb. It is true. So immobilizing a limb, we will use splint. Wound is an injury that causes internal or external break in the body tissue. Yes, so there will be wound will cause internal or external break in the body or skin. So that is a correct statement. Aging is normal part of human development. It is. Aging is a normal part of human development. The 8th cranial nerve is optical nerve. It is a false statement. Next one is lignocaine is used as a local anesthesia. Yes, lignocaine can be used as a local anesthesia. It is widely used as a local anesthesia. Inflammation of stomach is known as glossitis. No, it is not the right answer. And air at the pleural space is termed as pneumothorax. X. That is true statement. So air in the pleural space is known as pneumothorax. So these are some the following true or false questions. So true or false questions also you will get in your exams. So next we will discuss about some of the important disease conditions. So what is Addison disease? It is a disorder caused by insufficient production of hormones like cortisol and aldosterone. So if the person's body is insufficiently producing the hormones like cortisol, aldosterone by the adrenal glands, that disease is known as Addison's disease. So it's a disorder caused by insufficient production of hormones by the adrenal glands. So what are the hormones? Cortisol and aldosterone. So next disease condition is bronchiectasis. So what is bronchiectasis? It's a condition in which the permanent dilatation or damage of bronchi. So it will be the permanent damage or dilatation of the bronchi leads to mucus buildup and recurrent lung infection. So that disease condition is known as bronchiectasis. It's a condition in which there is permanent dilation or damage to the bronchi. So next is hypovolemia. So what is hypovolemia? Can a condition or a disease condition characterized by decrease in the volume of blood or body fluids. So there will be reduction in the blood or body fluids, usually due to bleeding, dehydration or fluid loss. So that disease condition is known as hypovolemia. So next one is diarrhea. It's a condition which person passes frequent loose or watery stool. So condition where that person having frequent frequent loose or watery stools, often due to infection, food intolerance or intestinal disorder. So once in a while every person will get diarrhea due to any food poisoning, any microorganisms in the food. So that will cause frequent loose or watery stools. So that disease condition is known as diarrhea. So the next one is DOTS therapy. So what is DOTS therapy? Directly observed treatment short course. So what DOTS stands for? Directly observed treatment short course. It's a WHO recommended treatment strategy for tuberculosis. So it is mainly for tuberculosis control. It's a WHO recommended strategy, that is directly observed treatment short course. So where patient will take TB medicine under the supervision of health worker to ensure proper treatment. So the medicines, they should be the patients who is suffering with tuberculosis, they'll take in front of the healthcare worker. That is directly observed treatment short course. So that is their WHO strategies to control tuberculosis. So it is DOTS therapy. Next we will see care of elderly patients with urinary incontinence. So how we will care the patients involves helping older adults to manage loss of bladder control through regular toileting. So we need to teach them regular toileting, skin care, use of absorbent pads, bladder training, adequate hydration and emotional support to maintain dignity and comfort. So as a nurse, you need to teach them the toileting, you need to do the skin care, how to use the absorbent pads, bladder training should be done, adequate hydration should be maintained. So these are the care of elderly patient as a nurse you can do in the case of urinary incontinence. Next is ascites. What is ascites? Already we have discussed. It's the abnormal accumulation of fluid in the peritoneal or abdominal cavity. So in the abdominal cavity, there will be abnormal accumulation of fluids, commonly caused by liver diseases, heart disease or heart failure or cancer. So in these three conditions, what will be? Sometimes that patient will develop ascites, nothing but the accumulation of fluid in the peritoneal or abdominal cavity. So next one is bronchial asthma. So what is bronchial asthma? It's a chronic inflammatory disease of airways causing narrowing of the bronchial tubes. So here it is a chronic disorder where the narrowing of tubes will be there, leading to difficulty in breathing, wheezing, coughing and chest tightness. It is often triggered by allergens like infections or environmental factors. So asthma, almost some of the the children will suffer more asthma, that is a chronic inflammatory disease of the airway where there's narrowing of the bronchial tube which causes difficulty in breathing, wheezing, cough and chest tightness. So next we will see about refractive errors. So what is refractive errors? It's a defect in the eye that causing improper focusing of light on retina. Improper focusing of light on retina leading to blurred vision. Examples include myopia, nearsightedness, hypermetropia, farsightedness and astigmatism. So that's are the examples of refractive errors. Next disease condition, that is pericarditis. So what is pericarditis? It's the inflammation of pericardium, a thin membrane surrounding the heart, often causing chest pain and breathing difficulty. So for these disease conditions, if you want further explanation, you can go through Ezinurse. So next is rule of 9 in the case of burns. So we will calculate the area of percentage of area the person had burns. So we will use rule of 9. It's a method to estimate the percentage of body surface area burnt. In the case of burn, how much the percentage of body is having the burns. So it is helping for the fluid replacement and treatment planning. So after that percentage only we will calculate how much fluid should be replaced back to the patient. So it is an estimating the percentage of body surface area burn. So we will use rule of 9 techniques. So next is hemorrhage. So what is hemorrhage? It is the excessive or uncontrolled bleeding from the blood vessel either inside or outside the body. So it's a uncontrolled bleeding. So that is what called hemorrhage. Next word is dermatitis. So what is dermatitis? It is the inflammation of skin. It is the inflammation of skin. That is what called dermatitis. It's causing redness, itching and swelling often due to allergies, irritation or infection. So these are the some of the words that is or some of the disease condition you need to study further. About the disease condition you need to study the definition, causes along with clinical manifestations or signs and symptoms and diagnostic evaluation, medical, surgical and nursing management. So next we are going to discuss about disaster. So what is disaster? It is the definition. It's a sudden catastrophic event that causes widespread destruction, loss of life, property and resources and dispute normal functioning of the society. So it's a example, flood. Heavy floods will be there, tsunami, so that kind of things, or earthquake. That's are examples of disaster. It's a sudden catastrophic event that causing widespread destruction, loss of life, property and resources, and it disrupt the normal functioning of the society. So here, what are the necessary responsibility in disaster management? As a nurse, what you will do in the disaster management? Preparedness, participating in disaster drill, training and planning. As a nurse, you should have the planning, have the training, have the skills to manage a disaster. So that is preparedness. Next is response, providing first aid, triage, emergency care and emotional support to the victims. Recovery, assisting in rehabilitation and community health restoration. Prevention, educating the public about disaster preparedness and safety measures. So these are the nurses' responsibility in the case of disaster management. Let's move on to the disaster management cycle. So what is the first step? Mitigation. So the first step is in the disaster management cycle is mitigation. Action taken to reduce or eliminate the impact of disasters. So in a particular area, we know that there is a chance of flood when the heavy rain is there. So from that area, the people should be moved to other safe areas. That is what called preparedness. Actions taken to reduce or eliminate the impact. So after, if that area is particularly prone for or known as a flooded area, then from that heavy rain time itself, we will shift the people, then we can reduce the impact. So that is what called mitigation. Actions taken to reduce or eliminate the impact of disaster. Example, building flood barriers, enforcing safety codes. Preparedness. So the second step in disaster management cycle is preparedness. It is planning and training activities done before disaster to ensure an effective response. So before that disaster occurs, we need to have the planning and training activities. Example, disaster drills, emergency kits and evacuation plans. So the next third step is response. What is response? Immediate actions taken during and after a disaster to save lives and to reduce damage. So to reduce damage and save life, we need to immediately act after the disaster. So that is what called response. Example, search and rescue, first aid, providing food and shelter. So that is the response. So the fourth stage is, or the fourth step is recovery. Long-term activities to restore the normal life and rebuild affected communities. So from this, after that, we will come back to the normal. So that is what called recovery. So long-term activities to restore normal life and rebuild the affected community. Example, rehabilitation, reconstruction and psychological support. So this is disaster management cycle. Next, we will discuss about surgical team. So what is surgical team? It's a group of healthcare professionals who work together to perform surgery safely and effectively. So who are the members in the team? Surgeon. Surgeon will be the leader of the team performing the surgical procedure. Assistant surgeon, helping in maintaining surgeon by helping the main surgeon by holding the instruments, cutting the suture and assisting in procedure. So that is assistant surgeon. Anesthesiologist or nurse anesthetist. Who is anesthesiologist? Administering anesthesia to keep the patient pain-free, monitoring vital signs and maintaining airway and oxygenation during the surgery. Next is scrub nurse or scrub technician, preparing and arranging sterile equipments and also supplies. So instruments, equipments and supplies should be sterilely kept in preparing, arranging. That is why done by scrub nurse. Assisting the surgeon by passing instruments during the surgery. Next is circulating nurse. Circulating nurse manage the overall environment of operating room. So she is the person or he is the person that is managing over the overall what happens in an operation theatre. Provide additional supplies, maintaining documentation and ensures aseptic techniques like the sterile techniques. She should maintain that sterile techniques. Next is operating room technicians. Who is operating room technician? Preparing the operating room, sterilizes equipment and assists the surgical staff. So this is a surgical team. Next, we are going to discuss about another important topic, that is glomerulonephritis. What is glomerulonephritis? It's the inflammation of glomeruli, the tiny filtering units in the kidney that remove waste and excess fluid from the blood. So it is an inflammation of glomeruli. That is what known as glomerulonephritis. So what are the causes here? Post-streptococcal infection, like after a throat infection or skin infection. Autoimmune diseases like lupus, systemic lupus erythematosus, diabetes or hypertension, certain bacterial or viral infections. So these are the causes of glomerulonephritis. So what will be the clinical features here? It is swelling or edema in the face and feet. So that person who is affected with kidney disorder, their swelling will be present in their feet or ankles. And decreased urine output, oliguria will be there, blood in urea, hematuria will be there, blood in urine, that is termed as hematuria, high blood pressure, fatigue and weakness. So that is the clinical features. Coming to the management of glomerulonephritis, antibiotics if infection present. So if bacterial infection, provide the antibiotics, antihypertensive and diuretics to control blood pressure and remove excess fluid, corticosteroids or immunosuppressants to reduce inflammation, dietary management, low salt or protein diet they need to have, and bed rest during the acute phase. So these are the medical management for the glomerulonephritis. It's nothing but inflammation of glomeruli. Clear? So if you want further explanation, further nursing management, nursing diagnosis, you can go through Ezinurse application where you will get second year GNM, MSN 1 and 2. So next we will discuss about diabetic mellitus. This also is one of the important topic. It is a chronic metabolic disorder characterized by high blood glucose level, hyperglycemia due to defective insulin secretion or insulin action or both. It's where the body's blood sugar will be high and due to maybe either reduction in the production of insulin or the insulin secretion or insulin action won't be there in the body. So that is, it's a chronic it's a chronic metabolic disorder characterized by high blood glucose level. So what are the types here? Type 1, type 2 and gestational. Type 1 diabetes mellitus, type 2 and gestational. Gestational where the person pregnancy time, the mother will get the diabetes mellitus, then it is known as gestational diabetes mellitus. So what are the three classic P in or classical symptom of hyperglycemia? Polyuria. What is polyuria? Excessive urination due to osmotic diuresis from high blood glucose. Polydipsia. What it is? Excessive thirst. The person will have excessive thirst caused by dehydration from increased urination. Polyphagia. Excessive hunger due to body's inability to utilize glucose properly. Excessive hunger. So these are the P, that is polyuria, polydipsia, polyphagia. So what are the medications for diabetes mellitus? Oral hypoglycemic drugs for type 2 diabetes like metformin. It's an example. Metformin, it improves insulin sensitivity. Sulfonylureas, that is glimepiride and glycoside, that is stimulating the insulin release. DPP-4 inhibitors, that is helping to regulate blood sugar. Coming to the insulin therapy. So the patients need to take insulin therapy for that is short-acting insulin and long-acting insulin. So this is the management of a diabetes mellitus. Coming to the next one is diarrhea. So what is diarrhea? It's a frequent passage of loose or watery stools, often accompanied by abdominal cramps or pain, dehydration and electrolyte imbalance. So everybody will experience once in a while experience the diarrhea. It is the diarrhea is a frequent passage of loose or watery stools. It is mainly due to food poisoning or the food microorganisms present in the food or indigestion problems that will cause diarrhea. So what are the causes? Infection. Bacterial infections like E. coli, Salmonella typhi, viral like rotavirus or parasitic viruses. Food intolerance, lactose intolerance, spicy or contaminated food. Next is medication, some use of antibiotics or laxatives. Chronic disease like irritable bowel syndrome or Crohn's disease. So these are the causes of diarrhea. So what are the clinical features here? Frequent watery stools. Abdominal pain and cramps will be there. Nausea and vomiting, dehydration, dry mouth, decreased urine output. How to manage this? Hydration. Oral hydration solution like ORS solutions and IV fluids. Diet. Easily digestible food and they need to avoid fatty or spicy food. Medication. Antimicrobials if infection present. Antidiarrheals in specific cases. Nursing care, monitor the vital signs, fluid balance and signs of dehydration, maintain hygiene to prevent the spread of infection. So these are the management of diarrhea. So diarrhea, its causes, clinical features and management. Next, we will discuss about inflammation. So what is inflammation? It's the body's protective response to injury, infection or harmful stimuli. Our own body will protective that action to an injury, that is what called inflammation. So body's protective response to injury, infection or harmful stimuli. Characterized by redness, heat, swelling, pain and sometimes loss of function. It purpose to eliminate the cause of injury and begin tissue repair. So that is why inflammation occurs. So what are the types of inflammation? Acute, chronic and subacute. So what is acute? Sudden, short-term, redness, heat, swelling. Example, appendicitis. Example, it's appendicitis. Chronic, long-lasting, ongoing tissue damage. Example, tuberculosis, rheumatoid arthritis. Subacute, between acute and chronic. Example, some glomerulonephritis cases. So next one is deafness. So what is deafness? It is the partial or complete loss of ability to hear. It is the partial or complete loss of ability to hear which can affect one or both the ears and may be congenital or acquired. So it is partial or complete loss of ability to hear. That is what known as deafness. So what are the types of deafness here? It is conductive, outer or middle ear problem. Example, wax or infection. So that is conductive hearing loss. Sensorineural, that is inner ear or auditory nerve damage. Due to that, mixed combination of both conductive and sensorineural, central brain auditory center damage and functional, no physiological cause, psychological origin. So these are the types of deafness. Coming to the management of deafness, medical, treatment of infection, removing the wax, medications and also antibiotics and steroids. So surgical, myrenchotomy, tympanoplasty and cochlear implants, supportive hearing aids, speech therapy, sign language and ear care education. So these are the main management. So further details and further disease condition that affecting the ear, you can go through Ezinurse application. So next we will discuss about typhoid fever. So what it is? It's a systematic bacterial infection caused by Salmonella typhi transmitted through contaminated food and water. So it's a infection that is systemic bacterial infection caused by Salmonella typhi that is transmitted through contaminated food and water. So that is typhoid fever. What are the causes? Ingestion of food and water contained with Salmonella typhi, poor sanitation and hygiene. So what are the clinical features of typhoid fever? Persistent high fever, weakness and fatigue, abdominal pain and diarrhea or constipation, headache and loss of appetite will be there, rose colored spots on the abdomen. So these are the symptoms of typhoid fever. So how we can do the management? First is medical management. Antibiotics like ciprofloxacin, azithromycin or ceftriaxone and fever control paracetamol. Coming to the nursing care, monitor vital signs and hydration status of the patient, encourage oral fluids and nutritious diet, maintain strict hygiene to prevent the spread, educate patient and family about sanitation and food safety. So this is typhoid fever. It is a communicable disease. It's a systemic bacterial infection caused by Salmonella typhi transmitted through contaminated food and water. So next disease condition is dermatitis. What it is? It's a skin allergy. So dermatitis is the inflammation of skin that causes redness, itching and swelling. So what are the types? Atopic dermatitis, also known as eczema. It's a chronic skin infection often due to allergies. That is atopic dermatitis. Contact dermatitis caused by exposure to irritants or allergens. From the irritants or allergens, if that person is getting dermatitis, it is contact dermatitis. Seborrheic dermatitis, affecting the areas with sebaceous glands like scalp. So if it is particularly affecting the sebaceous gland, it is seborrheic dermatitis. Next is stasis dermatitis, associated with poor circulation, often in the lower legs. So these are the types of dermatitis. So now let's discuss about the treatment. So what are the treatment? Topical corticosteroids for inflammation. So inflammation we need to reduce. We'll administer topical corticosteroids. Moistures to prevent skin dryness. Antihistamines for itching. So these are the main medications or management in the case of dermatitis. Yes. So till now in this section we had discussed the important topics from the medical surgical nursing 1. Now let's discuss about medical surgical nursing 2. So that is also a separate subject like medical surgical nursing 2 in the second part. So what are some words we are going to discuss? Give the following meanings. So let's discuss some of the word meaning from the medical surgical nursing 2. So what is photophobia? It is a sensitivity or discomfort of eyes to light. If that person is having a sensitivity to light, then it is known as photophobia. Sensitivity or discomfort of the eyes to light. Next is radiotherapy. It's a treatment of diseases, especially cancer, using ionizing radiation. So we are using ionizing radiation for the treatment purpose. Then it is known as radiotherapy, mainly used in the case of cancer treatment. Next is lordosis, excessive inward curvature of lumbar spine, often causing sailback appearance. So the excessive inward that curvature will be having excessive inward curvature of the lumbar spine. So that is lordosis. Next is arrhythmia. So what is arrhythmias? Abnormal heart rhythm, either too fast or too slow or irregular. So irregular, abnormal heartbeat is known as arrhythmias. So arrhythmias will be sinus tachycardia, sinus bradycardia and also other disorders. So if you want to study detailedly about the arrhythmias and its subtypes, you can download Ezinurse where we have already explained about its detailing. So next is labyrinthitis. So what is labyrinthitis? It is inflammation of inner ear causing dizziness, vertigo and hearing loss. Inner ear infection is known as labyrinthitis. Next is metastasis. So we have already seen in the first part also. This is spread of cancer cells from one part to another part. That is what called metastasis. Epistasis, it is bleeding from the nose. So it's commonly known as nosebleed. That is epistasis. Alopecia, loss of hair from the scalp or from the body, that is loss of hair is known as alopecia. Cyanosis. What is cyanosis? Bluish discoloration of skin and mucous membrane due to lack of oxygen in the blood. So the oxygen in our body, in the blood, the oxygen level is decreasing. What will happen? Bluish discoloration of our body, like fingers, nails will be turning into blue, then face will be turning into blue, then that is what known as cyanosis, bluish discoloration of body due to lack of oxygen in the blood. Next is scabies. So what is scabies? Contagious. It is a contagious skin infection caused by Sacrobs scabiei mite leading to itching and rash. So it's a disorder where it's a contagious disorder and it is known as infection caused by Sacrobs scabiei mite leading to itching and rash. That is what known as scabies. Chemotherapy, treatment of cancer using the drugs to kill or stop growth of cancer cells. Example, vinblastine and cisplatin. So that's an example of chemotherapy. So next is hemophilia. What it is? A genetic disorder caused by where there is a blood clot will be forming. So the blood clot does not clot properly, causing excessive bleeding from a minor injury. So if the person is having minor injury also, there will be excessive bleeding. Metastasis, spread of cancers from cells from the one side to another part. Acne vulgaris. So it's also one of the skin disorders. So what is acne vulgaris? Commonly known as pimples. So commonly it is known as or condition causing pimples, blackheads and whiteheads, usually on the face, chest and back. So that is known as acne vulgaris. So you can able to see pimples in your face. It is known as acne vulgaris. Stye. What is stye? It's a painful red swelling on the edge of eyelid caused by infection of an oil gland. So if you have any eye infection, like you can see able to see a pink or reddish color swelling in the eyelids, then it is known as stye. So otitis media, inflammation or infection of the middle ear. It is known as otitis media. So otitis media is one of the long essay questions or an important questions that may come for your exam. So study well about otitis media. Next is erythema. So what is erythema? Redness of the skin caused by increased blood flow to superficial capillaries. So it is redness of the skin. Redness of skin caused by increased blood flow to the superficial capillaries. Aneurysm. So what is aneurysm? It's an abnormal bulging or dilatation of blood vessel wall. So in the blood vessel, any bulging is there or any abnormal dilatation is there. That is what known as the aneurysm. So it's an abnormal bulging or dilation of blood vessel wall. Zoonosis. What is zoonosis? It's a disease that can be transmitted from animals to human. So it's an example, we can able to say Nipah virus. So Nipah virus is a disease, it is transmitted from the animals to the human. That is zoonotic disease. If the animals, from the animals, the person, human being is getting the disease, it is zoonotic disorder. Example, Nipah virus. So defibrillator. What is defibrillator? A device that delivers an electric shock to the heart to restore normal rhythm during the life-threatening arrhythmia. So we will use defibrillators. So you can see that in the movie Raja Rani, where that Nasriya will get a defibrillator shock. So that is what called defibrillator. That is a device delivering it. If that person is having abnormal breathing or abnormal heart rate, then what we will give? We will give a direct shocks using defibrillator. So that's an equipment. So next we will see about laryngitis. It's an inflammation of larynx, often causing hoarseness or loss of voice. So that is inflammation of larynx. That is what known as laryngitis. So next is a bacterial infection of skin and underlying tissue causing redness, swelling and mouth-warming pain. So this is dermatitis. So these are some words, meanings. Now let's discuss about fill in the blanks from the medical surgical second part. Inflammation of cornea is called what? What is inflammation of cornea? It is keratitis. Keratitis is known as the inflammation of cornea. Inflammation of tympanic membrane. What it will be? Myringitis. And dash is caused by the bite of dog, that is rabies. And chewing of dash is one of the associated factor of oral cancer. So what is the associated factor here? Tobacco. Tobacco chewing is one of the associated factors. Smoking is the main factor, and other than that, chewing tobacco is the next factor that is leading to cancer in mouth. Dash mineral is essential for bone healing. What it is? Calcium. So calcium is essential for bone healing. Enlargement of breast in male is termed as, what is that condition? It is gynecomastia. Enlargement of breast tissues in male, it is known as gynecomastia. Dash is an inflammation of nasal mucosa. What it is? It is rhinitis. Rhinitis is an allergic inflammation of nasal mucosa. Dash is a test used to diagnose tuberculosis. What it is? Mantoux test. If we were doing Mantoux test, we can able to diagnose tuberculosis. Inflammation of breast is called mastitis. Drainage from the ear is called otorrhea. And acute peristonsillar abscess is known as quinsy. Simple fracture is also known as closed fracture. So the person having simple fracture, it is also known as closed fracture. Cancer arising from the dash is known as hepatocellular carcinoma. So what it is hepatocellular carcinoma? The cancer that is arising from the liver. So that is the answer. Inflammation of eyelid is known as blepharitis. Surgical reconstruction of middle ear bone to restore the hearing is known as ossiculoplasty. Yeah, so these are the some important fill in the blanks questions were already repeated many times in the exam. So study well. This may, from this either 1 or 2 or 3 you can expect in your exam, because these are the repeated ones. So now let's discuss about some true or false questions. Superficial skin infection caused by staphylococcus is also called impetigo. Is it true or false? It is true. So the superficial skin infection caused by staphylococcus is known as impetigo. Blood usually donated at blood donated at a time is 2 pint. Is it true or false? It is false. Usually 1 pint, about 450 ml of blood will be donated. So cholera is caused by Vibrio cholera. Is it true or false? It is true statement. Exposure to strong acid cause thermal burns. Is it true or false? It is false. So it is causing chemical. So if you are having exposing to strong acid, then it is chemical burns, not the thermal burn. Iris provides the color to the eye. Is it true or false? It is a true statement. So the eye color is provided by iris. World AIDS Day falls on December 2. Is this a statement true or false? It is false because it is on December 1st. So that's a wrong statement. Tinnitus is ringing and roaring sound inside the ear. So what is tinnitus? It is true. It is the ringing and roaring sound inside the ear. So that is what known as tinnitus. Difficulty in swallowing is called dysphonia. It is a false statement. It is called dysphagia. If that person having difficulty in swallowing, it is dysphagia. Dysphonia means difficulty in speaking or hoarseness of voice. So X-ray is a painful procedure. Is it true or false? It is a false statement. It is painless diagnostic procedure is X-ray. World Health Day falls on April 10. Is it a true or false? False. It is observed on April 7. So April 7 is World Health Day. It's not April 10. Instrument used to examine internal structure of the ear is otoscope. Is it true or false? It is true. Otoscope is an instrument that we are using to check for the or diagnose diseases from the ear. Abnormal sensitivity to light is known as photophobia. Is it true? Yes, it is. Sensitivity of a person to light is known as photophobia. So now let's discuss some other important questions. So what are the side effects of chemotherapy? What will be the side effects? Gastrointestinal or digestive system, nausea, vomiting, diarrhea, mouth sore, loss of appetite. So these are the gastrointestinal side effects of chemotherapy. Hematologic. What are the hematologic side effects will be? Anemia, leukopenia, thrombocytopenia. Hair and skin. Hair loss will be there. Dry skin, nail changes. Neurological, peripheral neuropathy also known as chemo brain. Others will be like what are the other symptoms will be there? Fatigue, taste changes, fertility issues, increased infection risk. So these are the side effects of chemotherapy. So next we'll see about refractive errors. So what is refractive errors? An eye disorder in which eye cannot properly focus on the light on retina. So that person's having the problem with eyes disorders where they cannot properly focus on the light on retina, leading blurred vision. They occur due to irregularities in the shape of cornea, lens or eyeball. So what are the types? Myopia, nearsightedness, distant objects appear blurry, light focus in the front. So the distant object you will, if you can see it will be blurry. So that is myopia. hyperopia, close objects appear blurry, light focuses. So in the close objects, the things will be blurry, and that is what called hyperopia. Astigmatism, uneven curvature of cornea or lens causing distorted or blurred vision at all distance. At all distance, if you are having blurred vision due to uneven curvature of cornea or lens, it is known as astigmatism. Presbyopia, it's an age-related loss of lens flexibility, difficulty on focusing near the object. So presbyopia is an age-related problem where the person is having loss of lens flexibility, difficulty near object also we can't able to focus. So that is, these are the refractive errors types. So next we will discuss about nursing management of patient with psoriasis. So what is the nursing management of patient with psoriasis? First let's see about the definition of psoriasis. It's a chronic autoimmune skin disorder. So it's a chronic autoimmune skin disorder causing red, scaly, thick plaques due to rapid skin cell growth. So you can able to see in this picture, there is a red, scaly, thick plaque that is due to rapid cell growth. So that is condition is a chronic autoimmune disorder that is known as psoriasis. So what will be the nursing management? Keep skin clean, moisturized, apply prescribed topicals, monitor lesions and watch for infection, educate patient on triggers, skincare and follow up, provide emotional support for self-esteem issues, assist with phototherapy or systemic medication if prescribed. So this is a serious skin infection or as a skin disorder. It is a chronic autoimmune and it's causing red, scaly and thick plaques due to rapid skin growth. Excuse me. So let's discuss about another important topic, that is myocardial infarction. So what is myocardial infarction? Commonly known as heart attack. So it is myocardial infarction is commonly known as heart attack. It's a death of heart muscle tissue due to sudden obstruction of blood flow to the in a coronary artery, usually from blood clot or atherosclerotic vessels. So what it is? It's a heart attack. Nothing but due to death of heart muscles tissue. What will happen? Why? Because due to sudden obstruction of blood flow to the heart muscle. So that is what called myocardial infarction. So what are the causes? Coronary artery disease like atherosclerosis, hypertension, diabetes, smoking, obesity, obesity, sedentary lifestyle and high cholesterol, stress, family history of heart disease. It is nothing but myocardial infarction is nothing but heart attack where the causes are coronary artery diseases, hypertension, diabetes, smoking, lifestyle changes, sedentary lifestyle, obesity, high cholesterol, stress, family history of heart diseases. So these are the causes. Coming to the clinical features, severe crushing chest pain radiating from left arm, neck, jaw or back. So in the left region, left arm, neck, jaw or back, that will be severe radiating pain will be there. So from one side to the pain will be radiating. Shortness of breath, sweating, nausea, vomiting and also anxiety, dizziness and palpitations will be present. So these are the clinical features. Coming to the management, it is immediate care. Emergency we need to do, call emergency services immediately. Administer oxygen if hypoxic, pain relief with morphine, administer aspirin to prevent further clotting, monitor vital signs and cardiac rhythm. So medical treatment include thrombolytics to dissolve the clots. Thrombolytics should be done. Antiplatelets or anticoagulants like aspirin, clopidogrel and heparin, beta blockers like AZ inhibitors, nitrates as prescribed, percutaneous coronary intervention or coronary artery bypass graft, CABG indicated. Bypass surgery we need to do if indicated. So these are the management for myocardial infarction. Next disease condition we will discuss is glaucoma. So what is glaucoma? It's a group of eye disorder characterized by increased intraocular pressure which can cause optic nerve damage leading to progressive irreversible vision loss. So it's a eye disorder characterized by increased intraocular pressure. Inside the eyes, the intraocular pressure will increase which will cause the damage to optic nerve. If optic nerve is damaged, what will happen? Progressive irreversible vision loss. So that is what called glaucoma. So what are the clinical manifestations? Open angle glaucoma, usually asymptomatic, early, gradual loss of peripheral vision, tunnel vision in advanced stages. Ankle closure, glaucoma. Sudden severe eye pain, headache, nausea, vomiting, blood vision, halos around lights and red eye. Other signs are enlarged optic cup on fundoscopy and increased intraocular pressure. So these are the clinical features of glaucoma. So what will be the management of glaucoma? It is medication like eye drops to lower the intraocular pressure, prostaglandin analogues, beta blockers, carbonic anhydrase inhibitors, alpha agonists, and systemic drug emergencies. Laser therapy, that will be laser trabeculoplasty and laser iridectomy. Surgery, trabeculectomy or drainage implants to improve aqueous outflow. Nursing care, monitoring the intraocular pressure and vision, teach correct eye drop use, advice on activities that will increase the rising the IOP levels, ensure regular follow-up and provide emotional support. So these are the management. So detailedly, if you want to know about glaucoma and other eye disorders, you can refer to Ezinurse, and you can download Ezinurse from Play Store and App Store. So further explanations you will get from the application. So next we will see about varicose vein. So what is varicose vein? It's an enlarged, twisted and dilated veins. Enlarged, twisted and dilated veins usually occurring in legs caused by weak or damaged vein walls and valves leading to impaired blood flow and venous congestion. So there will be this picture, you can able to see there is an enlargement. So it's a enlarged, twisted and dilated veins usually occurring in legs caused by weak or damaged vein walls or valves leading to impaired blood flow and venous congestion. Next procedure is cardiac catheterization. So what is cardiac catheterization? It's a diagnostic and interventional procedure. Both are treatment, both are diagnostic procedure. Cardiac catheterization is both used for diagnostic purposes, also for treatment purpose. With a thin flexible tube, catheter is inserted into the blood vessel and guided to heart to assess the heart function, coronary arteries and the heart treat cardiac condition. So why we will use as a diagnostic? We will insert a catheter into the blood vessels and guided it into the heart. Then we can able to assess heart function, coronary arteries and to treat cardiac conditions like example angioplasty and stent placement. So that is cardiac catheterization. So what are the nursing care of patient with cardiac catheterization? Pre-procedure. Before the procedure, what are the things? Explain the procedure to reduce anxiety. Check allergies, especially to contrast dye. So after that, we will administer contrast dye to the particular catheter. So that we need to check for the allergies and get the consent. Assess vital signs and pulse and baseline lab. Ensure nil per oral status as ordered. So this is before the procedure. Coming to the during procedure. So during procedure, what we need to do? Monitor vital signs and ECG. Assess patients to maintain still position. Post-procedure include monitor vital signs, pulses and insertion site of bleeding or hematoma. So we need to see the surgical site where any hematoma or any bleeding is present. Keep limb immobilized if femoral access used. Observe for chest pain, arrhythmias or allergic reaction. Encourage fluid intake to flush contrast dye. Encourage patient to avoid rest, avoiding heavy lifting and follow-up care. So these are the post-procedure or nursing management after the procedure. So now let's discuss about another topic also is important from the musculoskeletal disorders, that is fracture. So what is fracture? A breaking or continuity in the bone, a break in the continuity of bone or a break or cracking the bone due to trauma, stress or underlying diseases that weakens the bone. So what are the types of fracture here? Closed fracture, so that is also known as simple fracture. Bone is broken but the skin remaining intact. So we can't able to see it from the outside, the skin remaining intact but the bone will be broken. Open or compound fracture, bone breaks and presses the skin. So it will be, we can able to see the bone will come out of the skin, increasing infection risk. Transverse fracture. Transverse fracture where break is straight across the bone. So there is a break will be straight across the bone. Oblique fracture. Break occurs at an angle to the bone shaft. spiral fracture, bone twist apart due to rotational force, right? Rotationally, spirally, the bone will be breaking. Comminuted fracture, bones break into several pieces. So inside the hand, if you have a hand fracture, it will have different pieces. The bone will be breaking. Green stick fracture, bone partially cracks commonly in children. Stress fracture, small crack from repeated stress or overuse. And pathological fractures occurs by weakened bones due to some disease condition like tumor or osteoporosis. So these are the types of fractures. So nursing management of patient with plaster cast. So how we will manage a patient who is having plaster? Assess. We need to assess the circulation, sensation, movement, monitor for pain, swelling and discoloration. Skin or cast care. Keep cast dry, intact, avoid inserting objects inside. So they'll feel itching. So avoid inserting anything inside the plaster cast. Pain management. Elevate limb, give analgesis as prescribed. Mobility. Teach crutch use, move unaffected joints. They need to move their joints like fingers, they need to move. Education. Report pain, swelling, order, maintain cast, hygiene. Complication prevention, watch for compartment syndrome, pressure sore or infection. So these are the nursing management of patients who is having plaster cast. Next disease condition we are going to discuss is AIDS. What is AIDS? Acute immunodeficiency syndrome. It's a chronic life-threatening condition caused by HIV, human immunodeficiency virus, that weakens the immune system, making the body prone to opportunistic infections and certain cancers. So it is the definition. AIDS is a acute immunodeficiency syndrome caused by HIV, human immunovirus. It will weaken the immune system. So what is the mode of transmission? Sexual contact, unprotected intercourse with an infected person, blood and blood products, transfusion, contaminated needles, mother to child during pregnancy, childbirth or breastfeeding, organ transplantation from infected donor. So these are the mode of transmission of HIV or AIDS. What are the clinical manifestations will be there? It is in early stage that person will have fever, fatigue, weight loss, night sweat and also swollen lymph node. In the intermediate stage, that person will have persistent diarrhea, oral thrush, skin rashes, recurrent infections. Advanced stage, opportunistic infections will be there. Tuberculosis, pneumocystis, pneumonia, cancers, severe weight loss, neurological symptoms. So let's see about the AIDS or HIV preventive measures. So provide, that is practice safe sex, condoms, avoid sharing needles or syringes, screen blood and organ donors, mother to child antiretroviral therapy during pregnancy, health worker precaution, use gloves, protective gear, safe disposal of sharps. So while treating the patients who is having AIDS, you need to use the personal protective equipment. So that is necessary to prevent disease transmission from the patient to the healthcare worker. Next is management. So what is management? Antiretroviral therapy controls viral replication, improve the immunity. Treat opportunistic infections promptly, provide nutritional support and psychological counseling, regular monitoring of CD4 count and viral load, educate patients on adherence, lifestyle modification and infection prevention. So these are the management of AIDS or HIV. Next disease condition or next important topic we are going to discuss is hypertension. So what is hypertension? According to World Health Organization, it's a condition where the systolic blood pressure is equal or above 140 mm of Hg and the diastolic pressure is more than or equal to 90 mm of Hg measured two or more separate occasions, indicating a persistent elevation in blood pressure. So one time if you are checking 140/90 your blood pressure, that does not indicate that you have hypertension. So two or more time the same reading is coming and it is done by a healthcare worker, then it is known as hypertension by the definition of WHO. So that's the definition of hypertension. Management of hypertension. So lifestyle changes will be there. Low salt diet, exercise, maintain healthy diet, avoid alcohol or smoking, managing the stress. Medications, diuretics, ACE inhibitors, beta blockers, calcium channel blockers and ARBs. Nursing care, monitor BP, educate about educate on medications and lifestyle changes, ensure regular flow. So this is a concise management. Hypertension, it's very important for you to study, so stay back and also go to Ezinurse application where you can see all the detailed explanation for this hypertension. So download Ezinurse from Play Store and App Store and use for study. So next is food poisoning. So what is food poisoning? A condition caused by ingestion of contaminated food or beverages. Ingestion of contaminated food or beverages containing toxins, bacteria, virus or chemicals leading to gastrointestinal symptoms like nausea, vomiting, diarrhea and abdominal pain. So it is nothing but if you are having a indigestion, we are having contaminated food and water, what will be? We will get the food poisoning. So next disease condition or next topic is retinal detachment. It's a medical emergency in which retina separate from the underlying supportive tissue, causing sudden vision loss or flashes of light. Sinusitis. So what is sinusitis? Infection or inflammation of paranasal sinus resulting in nasal congestion, facial pain, headache and discharge. Pericardial effusion. It's the accumulation of excess fluid in the pericardial sac surrounding the heart, which can compress the heart and impair the function. So it is accumulation of excess fluid in the pericardial sac. It will affect the heart functions. Now let's discuss about another topic, oral cancer. So oral cancer is also important. If any cancer, what is cancer? It is definition, it's a malignant growth of cells inside the particular organ. If it is oral cancer, it's a malignant growth that develop the tissues in mouth, lips, tongue, cheeks or throat, often starting as a painless ulcer or growth that can invert surrounding structures if untreated. So coming to lung cancer, what is the definition of lung cancer? The cancer cells or the multiple abnormal production of cells, abnormal multiplication of abnormal cells inside the lung or in the breast. You can use that definition if either any of the cancer if you are getting. So if it is a breast cancer, how you will write? Abnormal cell growth inside the breast, that is a malignant tumor. So tumors are malignant and benign. So benign is non-cancerous one, malignant is cancerous one. So what are the causes here? Tobacco use like smoking or chewing, alcohol consumption, poor oral hygiene, chronic irritation from sharp teeth or ill-fitting dentures, viral infections, genetic predisposition, nutritional deficiency. So these are the main causes leading to oral cancer. It is mainly smoking and use of tobacco. Management of oral cancer. So medical management include chemotherapy to shrink the tumors or treat the metastasis like vinblastine and cisplatin is the example. Radiotherapy to destroy the cancer cells in localized area. Targeted therapy for advanced or specific cancer type. Next is surgical management. How you will do? Tumor excision, removal of the cancerous tissue from the oral cavity, mandibulectomy or maxillectomy, that is partial removal of jaw if needed. So if involved jaw removal, that is what called mandibulectomy or maxillectomy. Reconstructive surgery to restore function and appearances. Neck dissection, removal of affected lymph nodes. Coming to the nursing care, pre-operative care, explain the procedure, assess the nutritional hydration status, emotional support. Post-operative care, monitor airway, bleeding, infection, maintaining oral hygiene, using gentle methods, manage pain and wound care, support nutrition. So patient education also is important about medication adherence, oral care, avoidance of tobacco and alcohol, follow-up visit. Psychosocial support, address body image, speech and emotional concerns. So these are the management of cancer or management of oral cancer. Next we will discuss about warning signs of cancer. So it is known as caution. So what is caution? C4, change in bowel or bladder habits. A4, that is a sore that does not heal. U stands for unusual bleeding and discharge. T4, thickening or lump in the breast or elsewhere. And I4, indigestion or difficulty in swallowing. O4, obvious change in water mold. And N is for nagging cough and hoarseness. So that is caution. So caution is known as the warning signs of cancer. Yes. So till now we had discussed the important topic and questions from both Medical Surgical 1 and Medical Surgical 2. I hope everyone understood. So for further explanation of any of these topics, you can go through Ezinurse. You can go through Ezinurse application from Play Store and App Store. So download Ezinurse for further videos and explanations. So study well and stay hydrated, have food and sleep well. Also study more. So we are Ezinurse here helping you in your exam. So all the best for your exams. Thank you.